वालेकुम वरहमतुल्लाहि वबरकातुहू। आज मेरा जो टॉपिक है वो ब्लाइंडिंग और मास्किंग पे है। सिंगल ब्लाइंड यानी आप कोई मेडिसिन दे रहे हैं तो सिर्फ पार्टिसिपेंट्स को पता, वो पार्टिसिपेंट जो है वो अनअवेयर है। द पार्टिसिपेंट्स आर अनअवेयर टू विच ग्रुप दे बिलोंग, स्टडी और कंट्रोल। डबल, द इन्वेस्टिगेटर और द पार्टिसिपेंट्स do not know the group allocations. Triple, none of the patients, investigator, or trial administrator know. Quadruple, patient, investigator, trial administrator, and data analyzer are blinded. Purpose of blinding: to remove subjective or judgment bias in reporting, evaluations, management, analysis of data. Endpoints, outcome measures. Clinical outcome: death, stroke, BP. Signs and symptoms: lab abnormality. Two types depending on natures: hard endpoints, surrogate endpoints. Hard endpoints, generally clinical endpoints: death due to any cause, death due to a cardiovascular or diabetic causes, non-fatal myocardial infarctions or stroke, and stage renal disease, time to clinical events. Surrogate endpoints, a biomarker intended to substitute for a clinical endpoint, HbA1c, serum cholesterol level. Measures of effect, to compare frequency of outcome between two groups, magnitude of relationship generally expressed as relative measures of effect, relative risks, odds ratio, absolute measures of effect, risk difference, number needed to treat, calculated using risk difference. Experimental and control event rates to compute measures of risk. Experimental event rate, proportions of people with interventions with the outcome are A over A plus B. Control event rate, CER, the proportions of people within the interventions who develop the outcome are C over C plus D. Relative risk, the ratio of incidence of outcome in those exposed to those not exposed. RR is equal to double ER over CER. RR applies to cohort study or clinical trial. Relative risk reductions, amount of risk reductions relative to baseline risk, or reduction in risk with the new therapy relative to the risk without the new therapy. Triple R is equal to double ER minus CER over CER. Summary: assessment for eligibility randomizations, allocated to intervention, received interventions, follow up, analyzed, and analyzed. This is for the control group as well as the test group. Reporting results trials, consolidated standard of reporting trials. The consort 2010 statement is an evidence based minimum set of recommendations for reporting RCT. Consort 2010 checklist and contains 25 items, many with sub items, focusing on individually randomized two groups parallel trials, which are the most common types of RCT. For other RCT study designs, consort extensions have been published. Some examples of are consort 2010 statement, extensions to cluster randomized trial, consort 2010 statement, non pharmacological treatment intervention. Thank you very much. Allah Hafiz.